South Africa is a country located at the tip of Africa, bordered by the Atlantic Ocean, Namibia, Botswana, Zimbabwe, and Mozambique. South Africa has a current population of about 48 million people and is experiencing rapid population growth characteristic of developing countries. Poverty in South Africa is currently at an all-time historical low, but the poverty rates remain very high. 20.2% of the population lives in extreme poverty and 45.5% in moderate poverty. South Africa offers primary free healthcare along with high-tech services. However, the public sector is under-resourced and under large amounts of pressure to deliver services to the majority of the population.
South Africa has the largest and most high-profile AIDS epidemic in the world. In 2012, an estimated 6.1 million people were living with HIV in South Africa, and 240,000 of them were dying of AIDS-related illness. There are 250 million children orphaned by AIDS. South Africa has a system of programs to help fight against HIV/AIDS, but the prevalence of the disease is still very high among the general population. The treatments and testing opportunities are more available to those members of the population living in urban areas, having a higher education and higher income. The HIV/AIDS testing and treatments are available to the majority of the population. South Africa has the largest antiretroviral treatment in the entire world, with over 2.5 million people receiving the treatment. However, it is still difficult for lower-income citizens to receive the care that they need due to location, and the clinics available to them do not always have the right equipment to treat their patients. At a cost of $10,000 to $15,000 per person annually, drugs were far too expensive for the majority of the people infected with HIV in South Africa. Although programs are in place to help prevent the spread of HIV/AIDS, certain members of the population are not being tested. Lower income and uneducated people who live in rural areas are more likely to not be tested for the disease, and therefore be unaware as to whether they can spread it or not, contributing to the HIV/AIDS epidemic.
Our first goal is to target the issue of the social and cultural stigma attached to HIV and AIDS. This stigma is preventing South Africans from wanting to get tested, which leads to higher rates of HIV transmission, as most people do not know if they have the disease or not. OHAPSA aims to target this issue by establishing a mobile testing clinic. This mobile clinic provides free HIV testing and targets underserved populations that are at high risk, including uneducated individuals who live in rural areas such as KwaZulu-Natal, where almost 40% of the local population is HIV positive. We aim to increase access by establishing mobile clinics that travel to rural areas with high-risk individuals and provide free treatment to individuals with AIDS. The mobile clinics will be staffed with trained medical professionals who prescribe a specialized cocktail of antiretroviral treatments tailored to the specific virus infecting that individual. OHAPSA will ensure that each mobile clinic purchased from Odulair is equipped and stocked with advanced medical supplies and drugs needed to detect, diagnose, and treat all variations of HIV. Additionally, the mobile clinic will be able to travel to each rural location about 2 to 3 times per week. Each clinic will be equipped to serve 500 to 1,000 patients daily, and the number of mobile clinics visiting each will be tailored to the number of high-risk individuals at the site. This ensures that each individual is seen without waiting too long. Since individuals will be receiving free treatment, the issue of affordability will be solved as well. OHAPSA will ensure that each infected patient is followed up with on a weekly basis. We will have our team of professional medical workers and nurses contacting patients via telephone and site visits on a weekly, monthly, or bi-monthly basis, depending on the severity of the case. This ensures that the individuals are educated and informed about their health throughout the treatment process. OHAPSA's third goal is to increase awareness and education about HIV/AIDS. This can be done using a multitude of platforms in order to reach out to the most number of individuals. The first platform we will use is the public education system. We will lobby for the Education Ministry of South Africa to require the incorporation of HIV/AIDS and sexual health education into the public education curriculum so that children are taught to be more aware at a young age. Next, we plan to educate high-risk communities that are home to individuals who have received little to no formal education. Uneducated individuals are more likely to be victims of HIV transmission and less likely to get tested. We will improve this by starting an initiative similar to the mobile health clinics in which professional health workers and educators travel to rural villages to educate locals about HIV and AIDS. This will also help to dispel the stigma attached to the disease. Secondly, educating and raising awareness amongst the general public will be emphasized by creating a large public advertising campaign utilizing billboard space, PSAs that are endorsed by local celebrities, doctors, and other officials, and the distribution of posters and pamphlets throughout the country.
OHAPSA ensures transparency in all aspects of a project, including its budget. For this project, we have been funded $1 billion. Most of this budget has been allotted to the mobile clinic project. The remaining $300 million will be split equally for the public education and campaigning projects. Funds for public education will mostly be spent on sending mobile education centers to rural villages and the implementation of health and sexual education programs in public schools. Funds for public campaigning will be spent on a variety of advertisements to raise awareness and educate the general public about HIV and AIDS. The $700 million allotted for the mobile clinic project will support various aspects of the project, including the medicine, staff, transportation, and the cost of following up with patients. Our goals by 2025. Number 1, decrease the number of HIV/AIDS related deaths by 20%. Number 2, increase the number of individuals treated by 20%. Number 3, decrease the number of mother-to-child transmissions by 45%. And number 4, increase the number of individuals eligible for treatment by 15%.